Hello and welcome to today's webinar. My name is Johnny Ross. I'm the founder and CEO of MedHab. Today we're going to talk to you about long-term care about your patients and revenue enhancement and a few products, StepRight and MyNotify, that can help with the care of your patients. Again, improving patient care while enhancing office revenue is the title of our discussion today. And it's a win-win for everyone. You'll see this through virtue of different codes, CPT codes, and technologies that you can use for the long-term care of your patients. Today, I'd like to introduce you to Dr. Paul Handel, who is your facilitator. Dr. Paul Handel is retired Senior Vice President and Chief Medical Officer, Healthcare Service Corporation. He's also a medical advisor to MedHab. As a disclaimer today, I do want to let you know that there are some dollar values from CPT codes that we have reviewed or researched, and these codes may be different in your geographical area. For example, we found these in the North Texas area. We suspect the reimbursements from Medicare will be similar, but not identical to what we have to show you today. Our agenda, short and sweet. We've introduced ourselves briefly already. We'll talk about learnings from telehealth, especially since COVID. We'll talk about the long-term care of your patients, StepRight and MyNotify that can help with that in your practice management. Otago, a wonderful exercise program that mitigates falls by up to 46%. That's embedded in this technology for the long-term care of your patients. And of course, what's dear and near to all of us is reimbursements for the services rendered for taking care of your patients. And then we'll round out with just the setup and call to action. Without any further ado, I will turn it over to Dr. Handel.
Great. Thank you very much, Johnny, and welcome to all of our viewers. Now, I love the start of this whole slide here. And are we into a new norm? And with that in mind, a close friend of mine sent me a Photoshop picture of Norm Peterson from Cheers. And I don't know if you recall him or not, but he's the man at the end of the bar having a beer. And in the Photoshop picture, he is wearing a surgical mask. And the caption is, "Are we into a new norm?" And the answer is, for all of us, I think we are. That prior to COVID, we saw telemedicine and remote patient monitoring taking place in rural areas or in remote places, fundamentally driven by either hospital systems or by academic centers. It was not really widely adopted or adapted at the time, but with the advent of COVID-19, things changed dramatically, and all of a sudden, people didn't have access to their doctors, they didn't have access to the clinics, and CMS ultimately, in their wisdom, and I think it was a wise move, turned around and said, we need to pay for telehealth visits and consultations. And as a result, this concept has taken root, and it's turned out to be remarkably effective and quite satisfactory both for patients and for physicians. What we sense now is that there'll be an improvement in the reimbursement. Who knows where that will set up and ultimately land. But most importantly, we now have a new tool in our armamentarium for helping to take care of patients and to see how they're doing in those interim times when they're not coming into the office. You see the next slide, Johnny? So the real question as we look at the opportunities that are open to the offices have to do with how do you best determine how to use it? And the most important question is, who are the best patients that will benefit from this? And once you have that sense, you can determine what is going to be the technology that you need to use to keep your patients actively engaged in whatever therapy you want to render to them. Long-term care is made a lot easier. And the other thing is that it really gives the patients a sense of how you are more closely following what they are actually doing. And near and dear to my heart is that potentially this can become a critical part of a wellness and prevention program for chronic disease patients, as well as those patients that have issues such as hypertension that needs a little bit closer tweaking, or even perhaps those patients that are in weight loss situations. Next slide, Johnny. So question is, how do we begin to really introduce the telehealth and remote patient monitoring into your practice? One of the questions that MedHab has dealt with for a while now has been, well, what happens when that 1135 waiver goes away? Well, the sense is it probably is not going to go away, and if it does, something is going to take its place in terms of perpetuating the ability to render either remote patient monitoring or telehealth for our patients. The benefits over and over again, we can see how our patients are doing when they're not in the office. And what a remarkable improvement that is going to be for us. Now, I don't know about you in your practice, but in my practice, there was always the sense the patient that I don't hear from is the patient that's doing well. And how often did we find out, no, the patient really wasn't. Our therapy, which we thought was doing what it was supposed to do, didn't work out. And that the other piece of it was, were our patients actually doing them to do? And the one point I want to highlight on this slide here is that as you use monitoring devices, we can indeed pick up adverse as well as positive trending that's occurring over time. Johnny, another slide.
Yes, sir.
Okay, ideal uses. Over and again, if our patients know that we care about them, even though at those times when they're not physically in the office, number one, it really makes them more apt to follow up what it is we want them to do. It really involves all of our staff and us in monitoring our patients, and then ultimately determining who on the staff would best be suited to following up with that particular patient. Now, ultimately, we can talk about therapists in remote care scenarios, which would enable us to care for more patients at any given time, and that we learned through COVID in particular, patient contact does not have to be real-time or face-to-face, but what perhaps is most important are the regular communications and also being with the patient when it's convenient for them to be with us. And as I mentioned earlier, one of the huge advantages is I think this becomes an integral part of wellness programs as we move forward. Johnny, next slide. Turn it back to you, Johnny.
Okay, thank you, Dr. Houndel. That was a great overview of telehealth and where we're going today. As stated, there are a few technologies here that can help you with the long-term care of your patients that MedHab has developed. And just to let you know, our technologies are Class 1 and Class 2 FDA devices. They're HIPAA secured, meet all FCC standards, and they are remote wearable devices that are app driven, as you can see by the photograph here today. The first of such devices is called StepRite. And just think of it like Dr. Scholl's insole. That's what it looks like with all the technology resonant within the insole. You wouldn't even know what's in there. It does gait analysis. Now you no longer have to send a patient to the lab. You know, this can be done in their living room, just walking back and forth. It looks at the force on there, the range of motion to the degree. as well as it looks at compliance when you set a rehabilitative protocol. Are they doing what you want them to do, and can they do what you want them to do? The data is here in dashboard form for you, and you'll know that to manage your patient. The sister product to StepRite is called MyNotify, and as you'll see here, MyNotify, it's a wearable device. It can be worn on either wrist. It can be worn in the bra. It can be worn in a shirt chest pocket or even the belt. It is efficacious for fall detection in all three of those locations. And I'll add, fall detection is an add-on feature to the device because it's really a therapy device as well, as StepRite is. Obviously, since it's worn on the wrist or can be on the lower extremities as well for therapeutic reasons, it measures range of motion, speed of motion in milliseconds, as well as compliance. And you can choose from a menu of about 60 exercises that are all American Physical Therapy Association approved to manage the patient to do what they're needing to do. In addition, both devices are they also feature what's called the Otago exercise program. I mentioned it earlier. It is a fall prevention series of exercises that is clinically proven to mitigate falls by 46%. That's all I'm going to say on that right now, because Dr. Handel will discuss a little bit more of that. And there's actually even CEUs available for that, for the program.
Johnny, may I jump in very quickly?
Please.
Yeah, back there with MyNotify, what really is important, and this highlights something I had mentioned earlier, is this allows us to pick up changes in what our patients are doing, and it may give us the added insight to modify whatever program they're on to prevent the possibility of a fall or further deterioration in their physical condition.
Thank you. So here, just a quick snapshot here. On the left, you can see what the StepRite insoles, how they look. They're very malleable. They just bend, they're soft, have a nice arch support built into them. The MyNotify wristband is right here. You'll also see it's magnetic. So if you have some issues with dexterity of fingers or loss of feeling, it's really simple. It slaps together nearly exactly where it needs to be by virtue of the magnetic ridges that are patented to hold it together onto the wrist. Both devices, for purposes of long-term care, come with a pulse oximeter because that is a requirement to look at either oxygen saturation, heart rate, and just pulse actually, to be eligible for RPM reimbursements through the program. So the device comes equipped with that as well. You get the pulse ox reading, in this case, at the beginning of the exercise regimen at the end. So you can see what's supposedly a rested heart rate and oxygen saturation versus one right after they've done the exercises. As I said earlier, you can see here that the devices are app driven, so they're very simple to use. You can see just a few little buttons here, and once you have those down, the patient knows how to use them. Both devices are shipped in a box similar to this. This you can see is MyNotify. If it were the insoles, this would be a cutout, and the insoles would be in there. But that's how it's delivered. They can be delivered directly to you at your office. If a PT is involved, you can go to the PT's office. Probably the easiest thing, and it can be done as well directly to the patient. So just a little bit more about MyNotify, how it works on the fall detection part of it. So, most fall detection devices, there's a $30 monthly or $50 monthly fee. That does not apply with MyNotify. Once the device is paid for through Medicare, I might add, which we're talking about, there are no additional fees. There's no call centers that the patient needs to worry about. In the event of a fall or any type of request for help, that goes directly to the family of caregivers that they select to be a part of their notifies, if you will. And there can be as many as they want. It can be their next door neighbor, their adult children, their spouse, grandchildren. It doesn't matter. So in the event of a fall, what would occur is the device would start to pulse vibrate, and there's a button on the device, or they can touch the app, and it'll turn off. And what that means is that they did fall, they need help, and they're letting you know they've fallen and need help. And that way you know that they're awake everybody, all, not you as the doctor, the family of caregivers would know this, obviously, but they would get this simultaneously, not synchronously, because that's too much time and things can happen. They all know about it at the same time, so the coordination of care from their family is known, who's doing what exactly when. Now, sometimes we know the falls are very violent and the person may be incapacitated or perhaps unconscious. That's okay. The device will time out in exactly 1 minute, and then it sends an escalated message to the family of caregivers letting them know that the fall occurred and that the user of the device, mom or dad, was not able to activate or disable the device, meaning they could be in serious trouble. And of course, it's not only about the fall. You know, in some cases, there could be other, whatever comorbidity or just, they may just be feeling terrible that day and need help. They can just simply push the app, a simple button on the app, or push the device, and it will automatically send a request for help. So everybody knows mom or dad needs help. I do want to add that the device, you know, it is fully automatic and it is fully waterproof, not just for the shower, but it can be submerged. Okay. Really, as far as that goes, that's the added feature while you're doing the long-term care with the exercises and all. This is working in the background, keeping them connected to their family as well in the event of something, you know, going wrong. So basically, by the use of this device, they're getting like a PERS system on top of that, if you will. So a couple of sample dashboards, and we'll turn it back over to Dr. Handel. As I said, the StepRight device, it looks at force, gait, and range of motion. Here's a sample of a force exercise. You can see how the person's standing based on when they're on the insoles. You can determine left versus right foot and even quadrants. It's all time-stamped, left and right leg. And this little line graph here, you know, something that we put together over time because it's the symmetry chart, if you will. The closer these two are together, the more symmetrical your patient is. As we know, not all patients can reach symmetry, but at least, you know, if things start to degrade, you'll have a good look, you know, you'll see that in the line graph. Here's a sample of the gait analysis. And again, it's all time-stamped. You see the left foot versus right foot. This particular subject here, you see the red. They were never really able to move from supination to pronation. This is a person that had a partial knee done. So you can see on that leg there, they just don't go over to pronation the way they should because that's a varus knee in this case. But the left leg's perfect. When they walk, it moves to pronation, supination to pronation for forward propulsion as it should. So you can actually see that into the bar graphs, and these are done, or excuse me, into the graph. And these were taken directly out of the textbook, you know, the same graphs that they use in your textbooks. The other graphs that you will see with StepRight is a range of motion graph, which looks like this. In this case here, it's a heel raise. It shows the pie chart left to right. It even tells you left to right. But here, the subject was unable to reach certain parameters. In this case, it was the repetitions that you wanted them to, that the doctor wants them to do. They weren't able to achieve them. And it clearly shows you anytime they are unable to meet their desired repetition count, something may be wrong. Maybe it's hurting. They don't know how to do the exercise, but it's there and it tells you that because it understands if that's not finding that range of motion. This one here is a range of motion graph as well, but this is exclusive to my Notify. You can see the left and right here, the amber and the blue. Everything is time-stamped. Of course, this screen is static, but you can click degrees, repetitions, or speed, and it's represented up here as well in a line graph as we did here. And in this case here, you can see that this subject has fairly symmetrical on their active resisted extension. Again, if you see one or both arms start to decay in any of these exercises, or if it's a lower extremity, it leads to a good productive discussion with you and the patient or perhaps their family member as things are changing in their life. So here's just a blow up of that one of a range of motion screen for StepRight, just so you can get a better picture of it. You can see it always will have the picture of the exercise. It'll have the pie chart, left and right, easy to see right there. And then you can bear down here and you can see when they were able to do, and these are just, you know, tests right here. that if they're able to achieve their degrees, or excuse me, their repetitions or not. And you can drill down on this, go back any date that you want. You want to do day to day, you can do that. You want to go back a month or whatever, you can do that. And it'll line graph it out, and you'll be able to see how that patient has progressed or regressed potentially, given their situation. Dr. Handel, I'll turn it back over to you to talk a little bit about Otago.
Oh, yeah, and thank you, Johnny. And the devices really help and dovetail beautifully with Otago. Otago came out of the University of Otago in New Zealand and has really been looked at very carefully. And there have been a number of studies done. And Johnny made the point earlier, and it bears emphasizing that with the use of the Otago exercises, they were able to decrease falls and the injuries associated with it by at least 46%. And what's happened is that has now, the Otago exercises have migrated to the United States, and the University of North Carolina is now using that in their physical therapy area. And in fact, they offer a certification program in the Otago exercises that really would be beneficial, physical therapists in particular, to use that and then begin to work with the older patients who are definitely at risk for falling. Interestingly, and Johnny made the point earlier also, you get the groups involved in things like that, and it really makes a huge difference in patient outcomes. Next slide, please. Indeed, it was created to be done at home. It's on a one-to-one with a physical therapist. And the neat thing about it is that by looking at the results that you see, that Johnny had pointed out in the MyNotify and in StepRight, you can begin to appreciate how your patients are actually doing. Are they not only compliant with what's being done, but are they benefiting by the activities? And that becomes really critical, because ultimately, if they do these activities, exercises as prescribed, they do not go to the hospital. They do not get the comorbidities, whether it's a fracture or things of that nature. And it just makes a huge difference in their quality of life. And again, online certification program through the University of North Carolina, really important, wonderful thing for your office personnel to be actively engaged in also. Next slide. Talk a little bit about the continuity of care, and I think Johnny, I almost beat this one to death without the benefit of MyNotify, but without a question, what these two devices do, what MyNotify does, even without StepRight rather, is that it really gives us a view into what is being done in the home situation. How are the patients interacting with their therapists, and how are they doing with what we know they should be doing? Are they progressing adequately, or is this an indication to either intensify the therapy or on occasion even think about bringing them into the office sooner rather than later to see if there's something untoward going on with them? Next slide, Johnny. Turn it over to you.
Thank you. So, it's all about how do we integrate something like this into the practice, and RPM really is a pretty easy thing to do. Medicare they've been working on this program for quite a while, and they launched it really like in the late 2019, but the reimbursements were cleared for funding in January of 2020. In such, Medicare has created a new series of CPT codes for you. These are what I call the 99,000 series, 99000 series codes. For example, the three main ones I'll show you momentarily are 99456, 57, and 58 that pay for the services rendered by you for your patient. There's even a specific code 99454 that talks about that is specifically to pay for the device where Medicare pays for it. So the reimbursement's there for the time, the reimbursement's there for the device. Really, it comes down to your decision about delegation of documentation. And by rule, by Medicare, you can select anybody that you designate as a clinical staff. Anybody down as an MA can do this for you. They could collate the information, they can document, they can even do the outreach to your patients based on the weekly and monthly reports that the technology sends you. So you really just have to manage that. So now you have the opportunity for your staff to create revenue for you while you're seeing patients and doing the things that you need to do. Dr. Handel, have I covered all that on there, do you think?
I think you've done it beautifully, Johnny. I appreciate that. Yep.
Okay. So as we move on, as I said, there are monthly billable codes, CPT codes for your services and for the device. It does, by rule, it does require an annual consent. I mean, think about it. This is remote physiological monitoring. Medicare wants your patients on these for the long term so you can keep them out of the hospital. So it does require once a year, bring them in, get that consent, and you'll probably bring them in for any other reasons anyway, and that way you can continue the process. Again, by rule, they look at weight, blood pressure, pulse oximetry, or respiratory flow rate. One of those has to be in the technology that you utilize for RPM. So with the case, in the point of the case of StepRite or MyNotify, we have selected pulse oximetry. As I said, the devices for RPM come equipped with the pulse oximeter. The app, when it opens up, it asks them for the resting pulse ox readings. So they'll just type in their heart rate and their oxygen saturation value. They do their exercises. At the end, it asks them to do it again, and they put it back into the app, and therefore you have that information. Again, that could be a precursor to something more serious if you start to see those pulse ox readings start to really wane, or the heart rate, what have you.
Yep.
I've already talked about the documentation, so I'll just move on to the next slide. So, as I said, there are a few different codes here that are available to you to bill for the revenue enhancement part of this. I'm going to focus on 99454. That is the device code. So every month you would basically, would bill Medicare for that device. We in turn would bill you at the end of the month. It's in the rear, so there's no money out of your pocket, and that's how the device is paid for. It's pretty simple. 99453, you can see there is a one-time setup fee. That's if you elect to do that in the office with a staff member, which you certainly may and might want to for this reason. If not, we send the device directly to your patient, and we'll help them with that at no charge to her, him, or you. So here's where the rubber meets the road, though, is how do you get compensated for the work that you're doing with your patients? And again, I mentioned 99457 and 58 are the workhorse codes. There's probably about 8 or 10 different codes, but these here are the workhorse codes that you would use, or I might say potentially your MA would use to help you manage these patients. And you can see it's pretty clear here that the initial service is there for 20 minutes. That may happen towards the beginning of the month. And then later on in the month, you use 99458. As you can see here, you're really close to $100 per patient per month when you're using the RPM program through Medicare. Okay, this is aside from the 99454 for the device. Like I said, that comes from Medicare. That does not affect your revenue at all. These two codes are the workhorses for you. Now, on top of that, with the remote, the 99457 and 58, there's also the G codes for e-visits. You may be using these already, but if you're not, it could go through any portal that you're already utilizing. but it's for discussions with your patient. Again, it could be your MA doing this, and you can see here they're time bound. So it'll range somewhere from $12 to $35 a week. Every 7 days, these can be billed. Okay, so the RPM is billed monthly. The G codes here are billed weekly. So now you're looking at another almost $100 of services rendered that you may already be doing this, but maybe not billing your patients for. Now there's the code to do that. And these are not new codes. You know, irrespective of what happens with COVID and the waiver, which as Dr. Handel said, will he be here more than likely for the long haul. The 99,000 codes were done before COVID, so they're not going anywhere. That's outside of the waiver. These G codes are outside of the waiver as well. Principal care management. I'm going to turn this over just for a slide or two and let Dr. Handel talk about that in your consultation.
Yeah, and really appreciate this, Johnny. You know, the principal care management rather is an interesting concept. And you can see that fundamentally what this allows a physician to do is to have a consultation with a specialist when they're dealing with chronic conditions. And Johnny had mentioned here, arthritis certainly is a chronic condition, as well as several of the others. And what this allows a doctor to do is to actually bill for the time it takes for the consultation. And critically, and this was on the previous slide also, the documentation has got to support what it is that you're doing. Now, I've been in situations where, unfortunately, I've seen doctors who documented things just beautifully. Mrs. Jones still has the same headache she had last month, and I spent 10 minutes talking with her about that. Unfortunately, that turns out to be a red flag for not only Medicare, but for the insurance carriers also, because what we've got to be documenting has to do with the medical management, the complexity of care, and the complexity of the disease state that we're dealing with. Importantly, this is a situation where you need to be paid for what you're doing, but you can't just be doing things to get paid for them. Trying to see the next slide. Now, and let the viewers read this because they can read faster than I could ever speak to the rules. And the rules are really so important, as is the documentation. The most embarrassing thing that can happen is to submit billing and then have it reviewed and not only be denied, but then have Medicare or the carriers now get involved in some type of an abusive billing practice investigation. So would urge you to be sure that your documentation is up to snuff and that it really reflects the disease and the complexity of the decision-making that you're doing. Next slide, Johnny.
Mm-hmm.
Oh, turn it to you.
Okay, so back to the codes. I mean, there's really 2 PCM codes here, and you may be using these already in your consultations, but if you're not, this again may be something you're doing but just haven't been billing for. This is the same code here. You know, it just depends on who's doing it and for how long, quite frankly. So as you see in the North Texas area, you know, if it's the qualified healthcare, that'd be like you, for example, speaking with, you know, let's say a cardiologist or what have you, or maybe an orthopedic surgeon, then you're talking about that 30 minutes there is billed as you as the provider doing that, and it's somewhere around that $85 to $90 range. If it's a staff person having that discussion with, you know, the specialist, then obviously it's at a different rate, and then they would give you the information back however your office protocol would dictate. Quite simple. So the codes are there. You start looking at the use of it here. This is when a physical therapist is necessary. I'm going to let Dr. Handel talk about the clinical part of it, and I'll come back around with the coding part.
Yeah, and Johnny, this ties in with the Otago exercises and things that could be by prescription for your patients, rendered by physical therapists. And this becomes integral to their care. And going back to the original concept, it really allows you to see how the patients are actually progressing in between the times of the visits. And the neat thing about it, and I love this idea, yeah, you can reach out to your patients and give them that gentle nudge if they're not doing quite what they should be doing, or giving them the attaboy type of thing that you're really doing what needs to be done, and you just need to keep up the good work. Then the physical therapists, they get involved for the work that they're doing, which is appropriate, and that the doctors get involved and get reimbursed for what they're able to do in terms of the long-term and remote monitoring. Johnny, over to you.
Okay, before I talk about the codes, I do want to mention something. You really sparked my attention when you said the gentle nudge or the attaboys. And I think those are so important. And with our technology, I mentioned that we send out, there's a dashboard that can be utilized on a daily basis if there's like a therapy portion going on. But if it's the RPM part of it too, the dashboards are there for the weekly, for the daily view. But if it's your MA or somebody else in your office staff, we also roll up a week-to-week comparison based on tolerances and or compliance, as well as a month-to-month roll-up. So your MA can sit there and look at if the person is compliant and they're steady doing what they need to do, it's a great attaboy, or anything like that. I think so much of this encouraging of that age group is so important to keep them motivated to do what they need to do, and they know that you recognize it and appreciate that. And again, on the other side, when you see that they stop doing it for some reason or slow down, then you'll want to intervene right away so you can keep them healthy. And I think they will appreciate that too, the gentle encouragement, as Dr. Handel said. So now, when a physical therapist is necessary, believe it or not, as of May 1st, 2020, and this is because of COVID, quite frankly, physical therapists can now take care of patients long-term as well. So if you have needs for them because of their certain circumstances, their mobility or whatever the case may be, your PT can work alongside you with the physical therapy. It's not just in the acute setting anymore. If they do that physical therapy in the office, then they would use their traditional 97,000 eval codes that nothing changes. They do that the same, whether it's acute or chronic. Now, if the patient prefers, and if you prefer that this therapy is done, maybe it's a split between, in clinic, in at home, or maybe it's all at home, remote care, that's okay. Whenever the patient is engaged using this technology, whenever they're engaged remotely, the same 97,000 series codes are used, but a GT tag is put at the end of the number, the 97,000 code, that tells Medicare and the Advantage plan that is a remote session. My recommendation is don't take if your PTs or want to do this, they should call the Advantage plan and make sure that they are accepting the GT qualifier. It is our understanding that they are doing that, pretty well nationwide, but better be safe than sorry. That way, not only are they accepting it, but what are the reimbursements? Right now, they should be equal to what the in-clinic reimbursement is. Let's kind of take a look now at what this means as far as revenue and how that works. So as we talked about early on, the Remote Physiological Monitoring or Remote Patient Monitoring Program, RPM, was established by Medicare in late 2019. It was actually funded in January of 2020. And so when you take a look at this, there's a certain amount of revenue that can be generated on a per patient basis which would be new money to the bottom line. So if you take a look at the calculator here, making the assumption here that the average practice would have somewhere around 200 patients that would be eligible for this type of technology, meaning not just StepRite or MyNotify RX, it could also be a heart monitor or glucose monitor or whatever. There is a specific code based on what that would look like and what the reimbursement would be. So again, let's say we have 200 patients. You can see here CPT code 99453. That's for the device education, meaning that time you bring them into the office with the device, whether it's you or one of a clinical staff that you designate, kind of helping them out with the device. Now, we're with you all along. They have an 800 number. We'll help them pair, connect, and register. But then you still get that educational. It's around somewhere around a $20, depending on where you live. You're looking at about $3,800, based on 200 patients to the bottom line of your practice. Now below, you'll see there's CPT codes 99457 and 99458. And those are patient care management, and those are monthly. Of course, you would do 99457 as a precursor to 99458, but you do both in the same month. You're looking at around $100, $110 or so on the reimbursement for that. And as you can see, it's about like I said, $150 per patient per month. That comes up to about $122,000 to the practice on an annual basis. When you add the two together, you're looking at about 125, 126, depending again on where you live. Now, as you'll see here, CPT code 99454 is zeroed out, and there's a reason for that. Again, regardless of what device is being used, ours or other technology, that code is specific for the payment of that device on an ongoing and monthly basis, as long as that patient is utilizing that technology. And so Medicare pays roughly around $65, give or take. So what we do is we actually invoice monthly $60 for the device. And what we do is we actually bill that in the rears, meaning 30 days post the time that you prescribe the device for your patient. That way it gives you a chance to put your reimbursement codes for the device, as well as your services rendered, the 99457 and such, to Medicare for the care of that patient. So you'll receive an invoice towards the end of the month, which is for the previous, if you will. And that way there's no price payment on, it's borne on the patient, on you or your practice. It's paid for through that particular code. So it's a pretty easy thing to do. But as you can see here, taking care of your patients remotely and is doing such as what Medicare is looking for, there is a really nice benefit to taking care of your patients remotely. And again, the thing, as we talked about, this can be done by anybody that you designate as clinical staff. So while you're taking care of your patients, doing the things you need to do to run the practice efficiently, you could have a PA, a nurse practitioner, a nurse, or even an MA taking care of this business for you, and you're just managing it and earning that revenue. So putting it all together, this is really, we're coming to the home stretch here, so thank you for your time. Initial setup is key to success. And what I mean is set up in your office. Who is going to do what? If it's your MA going to do this, they get the doc, you let him or her know which patients require the RPM program, and then they take it from there. They can set up the account with us. We take care of the device getting to the patient, and you designate the clinical staff person, like I said. The reports go directly to him or her. They manage it, and you're overseeing that book of business now for your patients. Gives you time to continue to do what you need to do with your patients that are right there in your practice, as well as seeing new patients. So it's a pretty simple process. You'll be able to obtain baseline functional data as well. Like Dr. Handel really talked a lot about documenting the intervention, and it's all there. Matter of fact, with the reports that we have, quite a bit of the documentation on that is at least done. It's always there for you. Every screen is a print screen. So you have that part of it already done. It's just documenting whom and what codes, basically. So again, just one little bit further on putting it together. We've talked about the designation of the correct office staff, and you'll know who that person is. I don't think I need to continue on the talk about documentation. But there is a clear pathway, though. If there are issues that start to come up, an escalation of what happens, your staff is on top of that. They can get it to you right away because you'll be overseeing their work regardless. It's just an effective way to use your office personnel. And I'm not going to go through all of these because you can read, but I mean, it's there. The program is set up, launched officially and funded by Medicare in 2020, and it's now available for you to take care of your patients. So let's take a look now at pricing and how the devices are paid. And this is a little bit of a reiteration of the revenue calculator slide that we talked about just a few moments ago. But what I want to do is show you the parallel here, whether it's MyNotify or StepRite, the process is the same. And it all begins with code 99454, which is the education of the device. And again, that code is billed in the rears. And that's when your patient's in the office for the first time with their device. And that's roughly that $20 range or something like that, which brings about $3,800 to your practice. I think what's real important to note here and understand is when you're looking at the RPM program, there's certain things that Medicare is really looking for. They're looking at, weight, they're looking at oxygen saturation, heart rate, and such. And those are very, very important. So what we have done is we include a medical grade pulse oximeter at no cost. It's complimentary to the patient. Very simple to use. It's just it's a clip on the finger. It looks like an old clothespin clip. If you remember those, you stick it on the finger and you push the button, and literally in 5 seconds, it gives their heart rate and their oxygen saturation. And our technology, our apps are engineered so before they start their exercise, as soon as they open up the app and they connect to the device, it's going to pop up and say, please provide your pulse ox reading. They put it on, they do it, type in the numbers, and then they move on and they start their therapy. And at the conclusion of their therapy, another window pops up automatically, and now it's asking for them to do that again because now it's giving you the post-exercise or post-therapy pulse ox, heart rate and oxygen saturation. So you can see the before and after, what that means. And of course, as you know, that could mean, it's going to be some early indicators of pulmonary malfunction. But again, that's a free medical grade pulse oximeter that accompanies the StepRite or MyNotify device. We talked a lot about the monthly. Again, when you're looking at that, it's around $100 to $150 per patient per month, or roughly $1,800 per year of new money that can generate to your practice. And what better way to do that when you can do this with, like I said, anybody in your practice that you want to designate as that person engaging your patients, and you can manage that afar so you can continue to do the things that you need to do. Pretty simple program, very easy to get started, and we'll talk about that in the course of the next 2 slides. So how do you get started? The easiest thing to do, if you are ready to do so now, you could call the number there, 800-541-1420. We have a staff member ready to speak with you. They're not going to sell you on anything. They'll answer your questions and help you to register your account, which includes your NPI, because we do go through CMS to make sure all providers are active and in good standing with Medicare before they could utilize this technology, since it is a Medicare program. Like I said, again, you've noticed we keep beating this one to death. Designate your office staff. And when you set up the doctor's account, the designated office staff's email is also included there. And that tells us exactly where to route the reports for easy administration at your office. As well, once you're registered, at the portal here, you will be sent an email with links to little vignettes. And these vignettes are 2 to 3 minutes. They show you how to set a protocol, how to read a report, how to do this, how to do that, how to set up a patient. They're all 2 or 3 minute vignettes, and literally within about 35 minutes or so, you will have all of them viewed. And if you need any help with anything, 800-541-1420, we walk you through everything that you need help with. It's pretty simple once you get started. Dr. Handel, barring any, do you have any other comments you would like to?
Yeah, last thoughts for our viewers. This is truly, between StepRite and MyNotify, a beautiful example of how technology can really help us improve our care and our outcomes for our patients. Thank you very much.
Thank all of you for attending. Dr. Handel, as always, thank you for the incredible discussion today. All of you have a good and wonderful evening. Take care.